Good morning, everybody. First, I would like to thank the organizer for giving me the opportunity to present today the results. I will present only a summary of the study, and I can invite you to go to the session this morning at 11:30, room A2 for more extensive results. So. The AHL2011 study was dedicated to advanced Hodgkin lymphoma. Here my disclosure. So the purpose of the study was to evaluate in a strategy of de-escalated treatment in patients with advanced Hodgkin lymphoma who reach metabolic response after 2 cycles of escalated BEACOPP to allow to obtain disease control similar to 6 cycles of escalated BEACOPP with a lower toxicity. And the study randomized 823 patients who were randomized between the experimental arm testing the de-escalated strategy for patients with negative PET2, and after 2 escalated BEACOPP patients received 4 cycles of ABVD, and the dose intensity was maintained only for patients with positive PET2 who received 2 escalated BEACOPP. This experimental arm was compared to a standard arm with 6 escalated BEACOPP. That is the standard of treatment within the German Hodgkin study group, and the treatment which allow to obtain the better disease control published so far. So, in the experimental arm, 84% of patients reached a negative PET2 and received the de-escalated therapy. The disease control was similar in both arms, and progression-free survival was quite satisfactory, with a 5-year progression-free survival of higher than 85% in both arms, in 85.7% in the experimental arm. The overall survival was also similar in both arms, and the toxicity in the experimental arm, including serious adverse events, was significantly reduced. We reduced of about 40% the risk of serious adverse events. So, PET performed after 2 cycles of escalated BEACOPP can safely use to guide subsequent treatment and support the response-adapted strategy delivering 4 cycles of ABVD for patients with negative PET2, and we can reduce the treatment in most patients, 84% of patients, without impairing the disease control. This approach allows to significantly reduce the treatment-related toxicity in most patients, and the reduction of serious adverse events is about 40%, and provides similar patient outcome compared to standard escalated BEACOPP treatment. And we can consider that this approach is probably a new standard of treatment in this disease.